Vaccination policy unfolds as a pivotal and dynamic narrative within the realm of public health governance, where decisions and actions are meticulously crafted to protect populations from infectious diseases through immunization. This narrative interweaves through policies and measures designed to ensure widespread vaccine coverage, address emerging health threats, and contribute to global efforts in disease prevention. Imagine the immunization landscape analysis phase, where policymakers meticulously assess the epidemiological landscape, prevalence of vaccine-preventable diseases, existing vaccination rates, and the capacity of healthcare systems. This phase marks the inception of the vaccination policy narrative, emphasizing the need to understand the complex factors influencing immunization. As the narrative progresses, the vaccine development and approval phase takes center stage. Policymakers work to facilitate the development, testing, and approval of safe and effective vaccines. This phase involves collaboration with regulatory bodies, research institutions, and pharmaceutical companies to bring innovative vaccines to market. The narrative extends to the vaccine distribution and accessibility phase. Policymakers implement strategies to ensure the equitable distribution of vaccines, addressing geographical and socioeconomic disparities. This phase involves logistics planning, cold chain management, and partnerships to make vaccines accessible to all, including marginalized and vulnerable populations. Yet, the narrative encounters the vaccine education and communication phase. Policymakers address vaccine hesitancy and misinformation by implementing comprehensive public education campaigns. This phase emphasizes the importance of clear and accurate communication to build public trust in vaccination and counteract vaccine-related myths. In the immunization infrastructure and healthcare integration phase, the narrative adapts to the imperative of building resilient immunization systems. Policymakers invest in healthcare infrastructure to strengthen vaccination delivery, including routine immunization services and the integration of vaccination into primary healthcare settings. In the pandemic response and emergency vaccination phase, the narrative takes a forward-looking perspective. Policymakers develop strategies to respond rapidly to emerging health threats, ensuring the availability and swift deployment of vaccines during pandemics or disease outbreaks. In the global collaboration and vaccine diplomacy phase, the narrative extends beyond national borders. Policymakers engage in international collaborations to address global health challenges, contribute to vaccination initiatives in low-income countries, and support vaccine research and development on a global scale. In the ethical considerations and inclusive policies phase, the narrative becomes community-focused. Policymakers prioritize ethical considerations in vaccine distribution, ensure inclusivity in vaccination policies, and address issues related to informed consent, privacy, and equity. In the grand tapestry of vaccination policy, the narrative is one of prevention, equity, and the relentless pursuit of a world protected from vaccine-preventable diseases. It is a story that acknowledges the pivotal role of vaccines in public health, the importance of public trust, and the ongoing commitment to shaping policies that safeguard individuals and communities against infectious threats.